Your heart never stops working. From the moment you are born to the moment you take your last breath, it beats quietly in the background, adjusting to everything you do, everything you feel, and everything you experience. Most people never think about their heart rate unless something feels wrong, but the speed of your heartbeat can reveal far more about your health than you might realize. A heart that beats too fast or too slow is not just a number on a screen. It is a message from your body, and understanding that message could be life-changing. A normal resting heart rate for most adults typically falls between 60 and 100 beats per minute. This range exists because the body is designed to adapt. Your heart speeds up when you move, when you feel stress, when you are excited or afraid. It slows down when you rest, sleep, or feel calm. But when the heart consistently beats outside this range at rest, either too fast or too slow, it can be a warning sign that something deeper is happening beneath the surface. A fast heart rate, known medically as tachycardia, is usually defined as a resting heart rate above 100 beats per minute. On the other end of the spectrum, a slow heart rate, called bradycardia, is generally considered a resting heart rate below 60 beats per minute. While both conditions can be harmless in certain situations, they can also signal serious health problems if ignored. Let's begin with a fast heart rate. When your heart beats too quickly at rest, it means it is working harder than it should. This can happen for many reasons. Stress and anxiety are some of the most common causes. When your brain perceives danger, whether real or imagined, it activates the fight or flight response. Stress hormones like adrenaline flood your bloodstream, telling your heart to beat faster to prepare your body for action. In short bursts, this is normal and even helpful. But when stress becomes chronic, your heart may remain stuck in overdrive. Caffeine is another major contributor to an elevated heart rate. Coffee, energy drinks, pre-workout supplements, and even certain medications can stimulate the nervous system and push the heart to beat faster. Nicotine has a similar effect, narrowing blood vessels and forcing the heart to work harder to pump blood through the body. Over time, this constant strain can weaken the heart muscle and increase the risk of high blood pressure, heart disease, and stroke. Dehydration is a less obvious but equally important cause of a fast heart rate. When your body lacks sufficient fluids, your blood volume decreases. To compensate, your heart must beat faster to deliver oxygen and nutrients to your organs. This is why people often experience palpitations, dizziness, or fatigue when they are dehydrated. Many people confuse these symptoms with anxiety, never realizing that something as simple as water could slow their heart back to a healthy rhythm. Infections and fever can also raise your heart rate. When your body is fighting illness, your metabolism speeds up, increasing oxygen demand. The heart responds by beating faster. While this is a normal immune response, a persistently high heart rate during illness can place extra strain on the cardiovascular system, especially in older adults or people with underlying heart conditions. More serious causes of tachycardia include heart rhythm disorders, anemia, thyroid disease, and heart failure. In anemia, the blood lacks enough healthy red blood cells to carry oxygen efficiently. The heart compensates by pumping faster. In hyperthyroidism, excess thyroid hormones accelerate nearly every function in the body, including heart rate. Over time, this constant stimulation can lead to dangerous arrhythmias and heart muscle damage. A chronically fast heart rate is not just uncomfortable, it is risky. Studies consistently show that a high resting heart rate is associated with increased mortality, even in otherwise healthy individuals. The faster your heart beats at rest, the more wear and tear it experiences over time. Imagine running an engine at high speed all day, every day. Eventually, parts begin to fail. Now let's look at the opposite extreme, a slow heart rate. At first glance, a low resting heart rate may seem like a sign of excellent health, and in many cases, it is. Athletes and physically fit individuals often have resting heart rates in the 40s or 50s. This is because regular exercise strengthens the heart muscle, allowing it to pump more blood with each beat. A stronger heart does not need to beat as often to do its job. However, a slow heart rate is not always a good thing. When the heart beats too slowly and cannot pump enough blood to meet the body's needs, symptoms begin to appear. These may include fatigue, dizziness, shortness of breath, confusion, and fainting. In severe cases, bradycardia can lead to heart failure, cardiac arrest, or sudden death. One common cause of a slow heart rate is aging. As we grow older, the electrical system that controls the heart's rhythm can begin to deteriorate. The natural pacemaker of the heart, known as the sinoatrial node, may fire less frequently or irregularly. This condition, sometimes called sick sinus syndrome, can cause periods of abnormally slow heartbeats, often alternating with episodes of rapid heart rate. Certain medications can also slow the heart. Beta blockers, calcium channel blockers, and some antiarrhythmic drugs are designed to reduce heart rate and blood pressure. While these medications can be life-saving, they must be carefully monitored. Too much slowing can deprive the brain and organs of oxygen, leading to serious complications. Hypothyroidism, the opposite of an overactive thyroid, can also cause a slow heart rate. When thyroid hormone levels are low, the body's metabolism slows down. This affects everything from digestion to body temperature to heart function. Many people with hypothyroidism experience fatigue, weight gain, cold intolerance, and a slow pulse, often without realizing that their thyroid is the root cause. Electrolyte imbalances, particularly low potassium levels, can interfere with the heart's electrical signals and slow the heartbeat. This is why severe vomiting, diarrhea, or misuse of diuretics can be dangerous. The heart relies on a delicate balance of minerals to maintain a stable rhythm. The key difference between a healthy slow heart rate and a dangerous one lies in symptoms and context. A well-trained athlete with a resting heart rate of 50 who feels energetic and alert is very different from a sedentary person with a heart rate of 45 who feels dizzy and weak. Numbers alone do not tell the whole story. How you feel matters. Your heart rate is also deeply connected to your nervous system. The autonomic nervous system controls involuntary functions like breathing and digestion. It has two main branches: the sympathetic nervous system, which speeds things up, and the parasympathetic nervous system, which slows things down. Chronic stress tilts this balance toward constant stimulation, keeping heart rate elevated. Practices like deep breathing, meditation, and regular physical activity strengthen the parasympathetic response, helping the heart slow down naturally. Sleep plays a crucial role as well. Poor sleep or sleep deprivation raises resting heart rate and reduces heart rate variability, a key marker of cardiovascular resilience. Sleep apnea, a condition where breathing repeatedly stops during sleep, is strongly associated with both fast and irregular heart rhythms. Many people with sleep apnea are unaware of the condition, yet their heart pays the price night after night. Fitness level is one of the most powerful predictors of heart rate health. Regular aerobic exercise trains the heart to become more efficient. Over time, resting heart rate decreases, recovery after exercise improves, and the risk of cardiovascular disease drops significantly. Even modest improvements in fitness can lead to measurable changes in heart rate and overall heart health. Monitoring your heart rate is easier than ever. Wearable devices, smartwatches, and fitness trackers provide real-time data that can reveal trends over time. A sudden change in resting heart rate, either up or down, can be an early warning sign that something is wrong. Illness, overtraining, dehydration, stress, and hormonal changes can all show up first as changes in heart rate. The most important takeaway is this: your heart rate is not just a number. It is a reflection of your lifestyle, your stress levels, your fitness, your sleep, and your overall health. A fast heart rate may be telling you to slow down, manage stress, hydrate, or seek medical attention. A slow heart rate may be a badge of fitness, or it may be a signal that your heart's electrical system needs help. Listening to your heart means paying attention to your body. If you experience persistent palpitations, dizziness, fainting, chest pain, or unexplained fatigue, it is essential to seek medical advice. Early detection and intervention can prevent serious complications and save lives. In the end, the healthiest heart is not the fastest or the slowest, but the one that adapts effortlessly to the demands of life. A heart that speeds up when needed, slows down when it should, and rests comfortably in between is a sign of balance. And balance, more than any single number, is the true foundation of long-term health. If you found this video helpful, take a moment to like it. It helps more people discover important health information like this. Subscribe to the channel for more deep, honest conversations about your body, your mind, and your long-term health. And if you know someone who needs to hear this, share this video with them. One small action could make a big difference. Thank you for watching, and take care of your heart. It works for you every single day.